thought I'd start off with a little bit of history. So I did medicine back in the 90s, and can you believe I started in this room when I was 17 years old? So the first day I was here, I was 17, and the first thing we did was go down and look at the dead bodies in the basement. And I mean, that was a great way to work out who was going to faint and who wasn't. When I started out in medicine, it was very much around science. It was very much around biology, around molecules, and around operating. What we're seeing now is that the focus is increasingly shifting to information and data. You don't know what's the best operation to do unless you've got some data. You don't know what's the best drug to prescribe unless you've got some data. Training in this room or one like it for 6 years isn't enough informational learning to equip you to make that decision correctly for the next 30 years of your life, which is the model I was trained in. When I trained in this room, consumers weren't really mentioned other than in a paternalistic way, and they were seen as dependent or needing our help. I've seen a real shift in the way that we think about our consumers now, and rightly so, and our consumers are now a very important partner in the way that we make decisions, and they also need access to information the same way that the clinicians do. Digital health at University of Queensland is now established as a science. Digital health in Queensland and Australia has largely been entrepreneurial activity until recently. Entrepreneurs and big tech have really led the digital health charge in Australia and globally with very mixed results. It really has required an academic focus in order for our consumers and regulators to trust what we're doing. And that really is the driving force behind setting up the Queensland Digital Health Centre. The University of Queensland is one of the top 50 universities globally. This is one of the first times we've set up a new science for many years. We've also recognised that digital health is a team sport. It's not something that can be owned by medicine. It's not something that can be owned by computer science. It needs to be a team activity, and again, this way of working is new for a very old and very venerable institution. The Queensland Digital Health Centre is 1 year old. And we've been very careful to position this centre as not something that's going to churn out publications or get grants, but that actually has the quadruple aim of healthcare at the centre of everything it does. Better efficiency of care, better outcomes for consumers, better experience for consumers, and a good experience for providers. This is a slight shift away from traditional academic metrics, and I'll talk through those in a minute. They are important. But I believe this focus is why we have so many people in the room today. If this was a group focused on publications and grants, we wouldn't have the investment that we're seeing from our partners, and we wouldn't have you all here today. I do want to acknowledge the vision of the HERA team who did fund this group, and I will be eternally indebted to them for trusting us with such a large sum of money and such a new way of working. The university itself is actually not the most important person in healthcare. It is the healthcare providers. And we are support people, we are thinkers, and we are helpers. Our mission is to engage and to partner to create a digitally enabled learning health system where what you learned in a room like this 30 years ago isn't all the information you get to make decisions throughout your career. I want to briefly acknowledge the partners. So to pull a new centre together at the University of Queensland requires significant trust, and I know that the Vice-Chancellor's team actually phoned our partners to say, is this woman a mad woman? Probably some of them said yes, but they still funded us. So I did want to acknowledge Queensland Health, who have been absolutely brave in rolling out a single integrated electronic medical record across the state. Now, that bravery is something no other jurisdiction has been able to match yet. I want to acknowledge Stryker, the world's largest medical device manufacturer, who have invested heavily in our work. I want to acknowledge the CSIRO. It's been very important for us that we don't compete with AEHRC, but that we're partners. And so we've very clearly managed to sort out how we will do that. And in fact, we have conjoint appointments across both institutions. Health and Wellbeing Queensland. This fabulous organisation has a vision for data-driven public health, and I really want to acknowledge the support that Health and Wellbeing Queensland has given us. and QSIF. For QSIF are absolutely brilliant technical teams who have given us the safety and the security around our data management. And Health Translation Queensland, who have, of course, brokered many deals, including some of our MRFF bids. Last but not least, we've been very forward in establishing a consumer advisory committee. I don't think I should be dreaming up digital health ideas or data governance ideas without governance and input from our consumers. I really want to acknowledge that group again. I'm not going to go through this aim again, but what I would hope is that this thread comes through the work that you're presented with today. It's very important that this is our endpoint and not publications or grants. I thought about putting up graphs about the number of staff or the amount of money we've put in or the publications or the impact, but I didn't actually want to. I think it's distasteful. But what I will say is that we have been very successful in Category 1 funding. We are CIAs on several large Category 1 funding grants this year, and I hope that reinforces the faith that our funders and our industry partners have put in us. I'm very pleased to report there's 31 grants and contracts across the centre and over 67 papers. I'm not going to talk in detail too much about what we're doing because I hope the people far cleverer than me are going to talk about that today. But really important to the services we provide has been the partnerships we have with Queensland Health and Health Wellbeing Queensland and the ability to influence policy. In terms of education, we have set up our graduate certificate in clinical informatics and digital health, where we hope to get 10 people to break even, and I think we're now at over 90. Okay, and I think you to really tell the story of a centre through its Christmas party photos. So this was the second year. The first year there really wasn't a Christmas party, it was just me. This is the second year Christmas party. You can see there was enough people to comfortably just kind of fit in a back garden with my dog Milo there. And 2022, this was about half the people, so we booked out the Sanford pub. And look at all those smiling happy faces and those babies. We've done some work at charities to ensure that we don't lose touch, and particularly my colleagues who don't have contact with the general public, that we don't lose contact with how people who live on the line exist. And this is some of the charity work that's been going on. So more of our very, very clever people, and I put this one up just because I love the smiles and the happiness that we see. I'll show you next year's Christmas party next year. This is the Hero Showcase, where the Vice-Chancellor reflected on the year of work. So I'm going to stop talking. But one thing, and I think my story about starting in here as a 17-year-old focused on molecules, one thing that I've learned is that change is the law of life, and those who look only to the past and the present are certain to miss the future. And those of you who are still stuck on working in the ways we do now or used to will miss the future. I'm very confident there's no people in this room, however, that are going to miss the future.